This video will explore some of the background issues to do with medication adherence. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. It's well established that the main intervention we make in healthcare is to provide medication. There is also extensive research that shows, on average, about 50% of all medication is not taken as intended. Therefore, it is a really important area to explore in every consultation you have with a patient who has to take medication. Before we start, it's important everybody understands the definitions surrounding medication adherence. Compliance, a term that has been around for a number of years, means the extent to which a patient follows the practitioner's advice. This has largely been superseded, although is used interchangeably, with the word adherence, which means the extent to which a patient follows an agreed set of treatment or advice. Throughout this video, I will be using the term adherence. There is one further term we need to be aware of that is sometimes used interchangeably with adherence and compliance, but actually has a different meaning. That is the word concordance. Concordance is about a consultation and the extent to which two parties reach an agreement in a consultation. It has nothing to do whether the patient follows through with that behaviour, and therefore you cannot put a percentage or number on the extent to which a person is concordant. Let's explore the classifications of non-adherence. The first type of classification is around whether it is primary or secondary non-adherence. Primary non-adherence is when a patient goes to see a practitioner, is prescribed some medication, but never actually cashes in or collects that medication. In research, this hasn't been explored as extensively as the other type of non-adherence, which is secondary non-adherence. Secondary non-adherence has been far more widely studied and is about a patient who has collected their medication, and then we measure whether they take that medication as intended by the prescriber. We can then further classify adherence into active or passive. Passive non-adherence is often called unintentional non-adherence. It's where a patient would like to take their medication as intended by the prescriber, but something is preventing them or stopping them. This could be cognitive decline, i.e. they're unable to remember the times of the day or days of the week, or physical challenges such as they can't get into the medication packaging to pop the tablets or use their inhaler correctly. The other type of passive or unintentional non-adherence could be one where there is a knowledge deficit, i.e. the patient doesn't know or understand exactly how they should be taking their medication, or they have extensive confusing instructions on a range of medication that means it's easy for them to make mistakes. Active non-adherence, or intentional non-adherence, is when a patient makes a conscious decision that, I should stress, is logical to them while they choose not to take the medication as intended by the prescriber. This may include patients who stop taking medication because of side effects, or patients who take more medication because they are addicted to the effects of their medication. The vast majority of intentional non-adherence is to do with the patient's understanding or view of their health condition or their medication. As an example, patients who suffer from asthma may believe that their condition only affects them when they do exercise, and therefore only wish to use their reliever medication, not realising that in a medical view this is a long-term condition, and therefore it is very important to use preventer medication every day, even if you don't suffer from symptoms. Non-adherence can result in a number of different outcomes. This may be that the condition that they're suffering from is not effectively treated. This may lead to more appointments with their medical practitioners, more investigations to find out what's going on, more prescribing of additional medication to try and solve the original problem. Ultimately, this could lead to hospital admissions or negative health outcomes. All of these things have a significant cost not only to the patient but to society as well. It's therefore important we think about how we can address non-adherence within every single consultation. When thinking about the consultations with your patients, we must remember that non-adherence is the norm. 50% of all medication is not taken as intended. Therefore, we must not be judgmental when we ask about how they're getting on taking their medication. We must try and find out what is going on with our patients and ask them their view of the world. Until we understand what they are doing and how they're doing it and their logical reasons for doing what they're doing with their medication, we can then start to try and support them in making effective healthcare decisions. What we should be looking for is a patient who has informed adherence, i.e. understands what they are doing and the implications of that, so they can make a conscious and sensible decision that is not built on erroneous beliefs. In this video, we have just provided a quick overview of the definitions of adherence and the different classifications that exist. In our next video, we will start to explore how you can try and identify and address non-adherence within your consultations. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page and subscribe to these videos.